Hi everyone, Dr. Emmy from Pain Free and Fit. Today we're going to be presenting part one of our series on band exercises for shoulder impingement and arthritis pain. Hope you enjoy. So resistance band exercises are a great way to self-treat, self-rehab your shoulder impingement and shoulder arthritis pain at home. Shoulder impingement and arthritis is many times aggravated by mechanical problems that we develop as a result of poor posture habits, abnormal movement tendencies that we've learned over the years, muscle asymmetries, weakness of the rotator cuff in certain motions. So impingement and arthritis pain is many times aggravated by two different types of mechanical problems. One with the shoulder blades, such as rounded shoulders, tipped shoulder blades, elevated shoulder blade tendencies, downward rotated shoulder blade tendencies, abducted shoulder blade tendencies, or upper arm problems where the upper arm does not stay centered in the shoulder socket as we move forward and sideways and overhead, but moves slightly out of that position. Today we're going to be talking about a problem that corrects anterior glide syndrome in your shoulder. Now, anterior glide syndrome is where as you're moving your arm through various motions, as opposed to that upper arm being centered in the socket, it has a tendency to slide slightly forward in the socket, contributing to both shoulder impingement and shoulder arthritis pain. To check this on yourself, simply feel the front of your shoulder and move your arm forward. As you move your arm forward, normally you should not feel a bulging forward into your finger. Likewise, you can feel the back of your shoulder, and as you move your arm forward, that shoulder should stay pretty centered where it is. If you notice that you feel the mass that's underneath your fingers moving away from your fingers forward, that indicates an anterior glide syndrome and is possibly irritating and likely causing both shoulder arthritis and impingement pain. To correct this, we're going to stabilize the shoulder blade as we learn to pull the arm back in the socket, the corrective motion. Remember, the arm is moving forward, so we want to build the strength and the ability of the shoulder to maintain stabilization by pulling it back in the socket. Now, keep in mind, we're not trying to pull the whole shoulder blade back. That's a mistake. Many times my patients and online clients that I work with will, when they first try to make this motion happen, will move the whole shoulder blade back. We want to localize it just to the shoulder. We can do that with the arm down at the side, just a slight backwards motion. We can do it with the arm elevated 90 degrees or out to the side. Very slight motion of the arm bone moving back in the socket, maybe a 1/16 of an inch, 1/8 of an inch motion. Once you get the idea of that, and what will help you is if you stabilize the shoulder blade against a wall or a rack like this, so as you practice pulling your arm back in the socket, we're not going to be moving the whole shoulder blade back. Here the wall, or in this case the rack, is going to resist that, so I can really localize just a slight tension at different angles of my arm in the socket. All I'm going to do once I get that down with no resistance is I'm going to add some resistance. I'll anchor a band either straight forward or slightly higher or lower depending on the angle I wish to work at. I'll set my shoulder blade in a neutral position, meaning I won't be rounded or tipped, and I'm going to work on a slight motion pulling the band and stretching it as I pull the arm back in the socket. I can do this at different angles by turning my body or by positioning my arm. I can work at different elevations. Again, it's a very slight motion. I can move my anchor point depending on where I need it. If I have pain, let's say, at a particular range of motion, that's the exact range of motion that I want to work on or angle to train that backwards motion. If you have shoulder pain with impingement or arthritis at a certain position of arm elevation where you catch it right there, that's the exact angle you want to position yourself and work on this. Typically, if you have pain at a certain elevation and you pull back, both shoulder arthritis and impingement pain is going to be relieved by that backwards pressure. Building up the repetitions as well as the isometric hold time, where you hold the position back for longer lengths of time against band resistance, are both viable options to training your shoulder stability and helping with shoulder arthritis and impingement pain. If you like this video on shoulder arthritis and impingement pain, resistance band training, feel free to subscribe to our website. We've got a lot of great videos out there for shoulder pain. And remember, if you're looking for a great home exercise program, how to analyze your own shoulder mechanics, how to build a design corrective exercise program based on your unique shoulder problems, check out our shoulder healing exercise program available at painfreeandfit.com. I hope this Part 1 series on shoulder impingement and arthritis pain band exercises helps you with your chronic shoulder pain.